Welcome back. Now in this section of basic topics in medical science, we are going to discuss the second topic. In the first video in this section, we have discussed the stomas and that is available. In this video, we are going to take up another important basic topic and that is drains. So in this video, we are going to discuss the various types of drains with examples and what are the uses of drains, what are the associated complications if not properly used. So these things we are going to discuss in this section. Any object which is helping us in the drainage of body fluids, whether physiological or pathological fluids, that is called as drain. So, okay, now we know what is a drain, but where to use it? What is the use of these drains? So for that, the indications, few indications are there. An important thing is we must know that routine use for routine purpose means I have operated some patient and just whether required or not, I am putting a drain. That is usually not recommended nowadays. If indication is not there, don't put a drain. So for using a drain, an indication is always required, right? So one take-home message is whenever indicated, always put a drain. But if not indicated, don't use these drains as a routine procedure. Okay, Halstead stated that better no drainage than ignorant use of it. So it is always better not to drain than using the drain in ignorance. Okay, so as far as the indications are concerned, using a drain, there are broadly there are three groups, the three categories. Means what are the three basic indications of using a drain? Removal of existing pathological collections. One means there may be existed or existing this pus or blood inside. We want to drain it. So first indication, removal of existing pathological collections. Second, prevention of buildup of normal or potential abnormal fluids means during the surgery at present there are no collections, but yes, it is expected that during the post-op recovery or immediate post-op, patient may develop some fluid oozing or secretions, and that may turn up into a potential lethal post-operative status. So if we want to prevent it, the drain can be used. Prevention of buildup of normal or potential abnormal fluids. Even if something is coming out in the post-operative period, the intra-abdominal pressure will not rise if we have used the drain. And early detection of the disease status we can do, and accordingly we can take the decisions. So for preventing it, we can use drain, right? Third is for prevention of potentially life-threatening complications. Obviously, the same thing, almost, but in severity, we are 100% sure that this patient major surgery has been done, so we must put a drain in case some hemorrhage is being occurring or some other leak is there that is going to raise the intra-abdominal sepsis or the intra-abdominal collection, that is again hampering the output, the venous, the inferior vena cava output, that input is being minimized, hampered, having an effect over the cardiac output. Again, a series of events that can finally land up into a life-threatening complication. So these three important indications are there. Removal of pathological collection is there, we want to remove it first. Second, we want to prevent the abnormal level of collection of fluids. Third, presently everything is normal, but during the course of time, let's say in next 24 hours or 48 hours, there may be some oozing or bleeding. To prevent that, that particular thing, we can use it, this drain, to prevent it, right? We'll go through the examples. The first one, removal of existing pathological collections. Suppose there is fluid or blood or pus or air. Fluid, I think all of you know, any substance that can flow is called as fluid. That can flow means water can flow, CSF can flow, blood can flow, urine can flow, pus can flow, air can flow. So all these are collectively known as body fluids. Okay. So if there is any pathological collections, use drain. For example, if you want to drain a subphrenic abscess, or if we want to manage a case of pneumothorax, again air is the content and air is a fluid also. So for that purpose, we can use the drain, right? The second indication was, the example is prevention of buildup of normal fluid. Normal body fluid means, example, we have operated a case of, let's say, some bile duct stone, the open cholecystectomy or laparoscopic CBD exploration we have done, and in that case it is expected that bile in the post-operative period will ooze out, will come out, and it will get collected in the subhepatic area. So in order to remove it, we would like to put a drain there. The second one, the prevention of buildup of potential abnormal fluids or air. Example, whenever after any major surgery in the pelvis, the post-rectal surgery, the mesorectal excision, TME, total mesorectal excision, or any other rectal surgery, if we want to drain out the bloody fluid that may be present in the pelvic area, for that purpose we can use the drain. The third was prevention of potentially life-threatening complications. Initially, between this indication and this indication, some overlap was there, but after going through these examples, it will be clarified. Potentially life-threatening complication, and we want to prevent it. For example, thyroid surgery. In the post-operative period, neck drains are usually placed to take a control over the bleeding part in the post-operative period during thyroid surgery. It can save the patient's life. And in patients of chest trauma, and if that patient requires general anesthesia, precautionary, we can put a chest drain there, intercostal drains, right? Now, after going through the various indications, the three major groups with examples we have discussed, I'm sure you must have got an idea. If not, just again after finishing this video, you can just go through this video, and it will be probably you will understand the basic concept of using a drain. So potential complications are also there. If we are going to put a drain inside a patient, it is usually associated with, it may be associated with some complications. I will not say usually, it may be associated with some potential complications. Potential word means, okay, some complication is there, not life threatening, but if we are not managing the same, we are not careful, that may develop into a serious complication. This is the meaning of potential complications. Okay. Versus drain use. Which one is better? Always try to balance these two things. If it is urgently required, always put a drain. But if we are not going to get more benefit by putting a drain, instead of there are more chances of having a complication. So better to avoid in that scenario, better to avoid the drain. So potential complications versus drain use, we are supposed to balance it out. Now, what could be the possible drains complications? Four important groups are there, broad groups. During placement of a drain, there may be damage to the structures during insertion. One. Second, we have already placed a drain, but during the post-operative period, there may be damage to the structures that is lying close to the drain. How? We'll come to that. Third, long-term drain is there inside a patient and it is promoting or creating a potential route of introducing an infection. More liable to get an infection if the drain is being placed for longer duration, right? Then the fourth one is we have already placed a drain, but the drain is not working. The failure to drain leading to associated complications. How come? If a drain is not draining, it's okay, sir, not draining doesn't matter. But most of the time, if drain is not draining, it gives us a false sense of security. Patient may be having something bad or something undesirable inside and the drain is not draining. Only the distension of abdomen is being appreciated. So in that particular case, the patient may land up into associated complications. So there are four major groups of complications associated with a drain placement. Damage to structures during insertion. After the insertion, the surrounding structures may get damaged. Introducing an infection and failure to drain with associated complications. One by one, we are just taking the examples. Damage to structures during insertion means this damage may even occur during CT guidance or ultrasonographic guidance. So it is possible to have this. So be careful. For example, if somebody is draining a subphrenic abscess, in that case, the risk of injury to spleen is there. Or the hemorrhage from the abdominal vessels in operative drain during placement of operative drains. Hemorrhage may occur from the inferior gastric artery branches or itself, the inferior gastric vessels, or some other major vessels during insertion of the drain. So always put a drain with utmost care. Then the damage to structures close to the drain. Sometimes if we are using high pressure suction drainage in a particular setting, that may injure the bowel that is lying just by the side of the tube drain. The pressure injury to the bowel may happen if we are subjecting the patient to high pressure suction drainage. Okay. Then the third one, the potential route of introducing an infection, a long-term drain. Any external drain, if we are putting for a longer duration, it makes a patient more liable to get an infection if not taking care of that particular patient. And how much long duration? Usually we are taking it around 72 hours. If more than 72 hours, we are expecting a drain, external drain, the patient may be covered with good antibiotics, reasonable antibiotics. Okay. The fourth one is the failure to drain. Yes, I've already told you that it gives us a false sense of security. For example, a patient, post-thyroid patient, after the thyroid surgery, patient is bleeding inside but brain is not draining, then what it will do? That is going to raise the pressure over the trachea, and patient may land up into the tracheal complications, the chest complications, the dyspnea, right? Difficulty in breathing, and all associated incidences. The second example of this could be patient have undergone this exploratory laparotomy and anastomosis for anastomotic leak, and the fecal content is there inside the peritoneal cavity, but the brain is not draining. So again, a false sense of security, and there is higher chance of taking a late decision in the management of these type of patients. So again, associated complications, the septicemia, this all the septic shock features that may appear in these type of patients, and the prognosis may be somewhat bad. So always take care of this. If drain is not draining, just remove it. Now, after going through this part, the indications, the uses, and associated complications. Okay, let's discuss this thing in the next video, right? That's not to prolong this video. Just settle down. Just go through the indications of drain and associated complications with the 3 groups in indications and the 4 groups in complications, associated complications. Let's meet in another video. Thank you.